Welcome to the Public Health Practice Gap, where public health meets real-world systems, organizational strategy, and the gritty reality of implementation. I am Dr. Bradley Fevrier, founder of NextGen Public Health Consultants. Every week, we explore one central problem. It isn't that we don't know what works. It is that what works so often fails the moment it hits the pavement of the real world. That space between the gold standard, evidence, and the actual outcome is what I call the public health practice gap. Today's episode is a departure in topic, but not in structure. We are applying our systems framework to the most urgent crisis of our time: youth mental health and the digital systems shaping it. We have been told this is a screen time problem. We have been told it is a parenting problem. I am here to tell you it's a systems design problem. And until we treat social media as a behavioral health system, we are just rearranging deck chairs on a sinking ship. Let's look at the data. If you look at a graph of adolescent depression, anxiety, and self-harm, the line stays relatively flat for decades. Then, around 2012, the line doesn't just go up, it hooks, it skyrockets. This is where the work of Dr. Twenge is vital. In her research on iGen, she identified a massive shift in how a generation spends its time. Dr. Twenge's evidence suggests four major shifts: the displacement of the physical, where teens begin spending less time with friends in person than any generation in recorded history; the sleep tax, where smartphone use began bleeding into the golden hours of neurological recovery; and the loneliness paradox, where despite being connected, feelings of uselessness and loneliness among teens spiked by 50% between 2011 and 2015. Now, in public health, we are trained to say correlation is not causation. But as Dr. Twenge pointed out, when every single indicator of mental health well-being moves in the wrong direction, at the exact same moment a specific technology reaches 50% market penetration, we have to stop looking at the individual and start looking at the environment. We have to stop calling social media a communication tool. A hammer is a tool. A hammer doesn't care if you pick it up or put it down. Social media is a behavioral system. It is engineered. When a 14-year-old opens an app, they aren't just chatting. They are entering a high-fidelity feedback loop designed by the world's most elite behavioral scientists and engineers. Algorithms determine reality. Engagement loops exploit the dopamine pathways. Social reinforcements like comments, likes, creates a 24/7 digital popularity contest that the adolescent brain is evolutionarily unprepared to handle. Applying the practice gap model to the evidence, we know the risks, anxiety, sleep loss becomes important. Policy, we give the screen time, we give them tips. The gap, this is the actual operations of the system. The TikToks, the Instagrams remain unchanged. They are designed to maximize time on the platform, which is the exact opposite of the public health goal. Let's make this real. Visualize a 15-year-old student. They spend 6 hours a day in the system. They see curated bodies they can emulate. They see social events. they weren't invited to. At 11 p.m., when the brains need to prune synapses and process emotions, they are bombarded with blue lights and notification. Here is the tragedy. No clinician sees this 6-hour daily treatment. No public health department regulates this exposure. We are trying to fix a 6-hour-a-day systemic exposure with a 15-minute therapy session once a week. Why is public health struggling? Because we move at the speed of peer-reviewed journals. Social media moves at the speed of fiber optics. We have to talk about incentives. Social media platforms aren't evil, but they are aligned. They are aligned with engagement and revenue. In traditional public health, if a car is found to be unsafe, we have a system, the NHTSA, to recall it. If a drug is toxic, the FDA pulls it. But social media is a behavioral system operating at a global scale with zero consistent public health oversight. We keep trying to educate our way out of this. We tell kids to be mindful. You cannot educate a human brain to resist a system designed to override its biology. It is like telling someone to be mindful while they're standing in a room filled with smoke. You do not teach them to breathe better. You put out the fire or you change the ventilation system. So, what is the path forward? We must shift from program-based thinking to system-based intervention. This means, 1, we design standards, age-appropriate design that prioritizes neurodevelopment over likes. 2, policy change, real transparency on algorithmic impacts. And number 3, institutional accountability. We need to treat these platforms as the digital determinants of health they are. Social media is a behavioral system shaping health outcomes at a scale that rivals our hospitals. Until we treat it as an infrastructure problem rather than a parenting problem, the public health practice gap will continue to widen. If this episode resonated with you, I encourage you to explore more of this framework at nextgenpublichealthconsultancy.com. If you're a healthcare leader, an educator, or a policy professional trying to understand how modern systems are hijacking your health outcomes, this is exactly what I do. At NextGen, I help organizations translate these massive, complex challenges into actionable system-level strategies. Share this episode with one person, a colleague in public health, or a teacher on the front lines. Understanding the system is the first step to redesigning it. New episodes of the Public Health Practice Gap are released every Tuesday. I am Dr. Bradley Fevrier. Thank you for listening. Let's close the gap.